I'm Nicole Hunt. I'm a doula here in Sioux City.
And I'm Mallory Hertz. I'm a doctor of physical therapy, and I specialize in pelvic health physical therapy.
There's so many times where people are like, oh, we just want a healthy baby. And I think they totally forget self-care. They totally forget that they have to take care of themselves. And I see that so much as a doula, where it's just like you're watching, your loved ones, especially if you've had postpartum depression or anxiety, like you're just watching them and they're not even taking the time to take care of themselves. I'm sure that you would probably see way more postpartum clients, but they're thinking, I can't schedule another appointment for me because I have baby appointments, I'm returning to work, I'm breastfeeding, this child's eating every 2 hours.
And how do you time that? And now you're a new mom, and the anxiety of taking a baby out in public. But the topic that you hit on is actually, that's how our whole healthcare system is structured.
Yeah, I know.
Right? So we highly monitor women starting at, 9 weeks? Women should come in, do an ultrasound, and then we're going to see you monthly, and then we're going to see you every 2 weeks, and then we're going to see you every week. Maybe even more than that if there's other complications in between. And then you've got your dual appointments, right?
Yeah.
And then you have the baby. And then if you had a vaginal birth, traditionally you're seeing 6 weeks postpartum. If you've had a C-section, they see you at 2 weeks postpartum to check
with your
scar.
first. With your second, maybe it might be a little farther out because you really don't. I mean, I didn't take care of myself. I was taking care of children.
Right.
So it's, you got to take time for you.
So our whole healthcare system is set up to heavily monitor mom while she's pregnant. Once the baby's born, drop the mom, focus on the baby, and then the baby's got to go at 5 days and 1 month and 2 months.
Yes.
And so, like you said, you're so overwhelmed just by life in general that you forget to take care of yourself. On top of it, though, your healthcare provider is generally saying it's normal. Leaking is normal. Your pain is normal. The split in your ab muscles, if they've even checked it, is normal. Or these things aren't addressed at all, because it's really not the job of your medical professional, your physician or your OBGYN, to check your muscle function.
Right.
They want to check to make sure you're healing and that there's no infection. And then they want to talk about pregnancy prevention, because it wouldn't be good for your body to get pregnant again too soon. But they don't fill in the gaps.
Yeah, I think what you said earlier, you told me once that it's common, but it's not normal.
Yes.
And to them, they just see it as I see this all the time.
I see it all the time. And like we already talked about with Kegels, just do them.
Yeah,
but
don't forget to do your Kegels.
Just do your Kegels, but they don't give you any instructions. And so I think that's kind of where the gap is in our healthcare system. We aren't focusing on mom enough.
No.
And mom's body needs to be addressed. We need to address the ab muscles, scar tissue, if there's a C-section. Leaking is another big one. I spoke at a mom's group, not in this area, so I'm not implicating anyone. But I spoke at a mom's group a couple years ago, and I asked the rhetorical question, like, how many of you leak with jumping? And one mom's her arm shoots up and she's like, Sky Zone. And I was like, yes, so she couldn't go to Sky Zone and jump on the trampolines because she.
And if that room was honest, I bet everyone would be raising their hands.
Yes. And so it's very, very, very common. But if I can see these patients postpartum and assess their muscles, which no other health care practitioner does, because that's not their job, that's my job. I mean, your OBGYN doesn't do muscles. That's not what they're there for. So they can come to me and I can assess their muscles. We can get them back to their pre-pregnancy status, or as close to possible. If there was tearing, if there's nerve damage, there might be some complications, but PT can help get things moving along better and faster.
I 100% can attest to that. Yeah. I can go to Drop Zone, and I'm the mom. I'm like the one mom jumping on the trampolines at Drop Zone.
You just hand out.
I do. I'm like, here, you need to see Mallory. You need to see Mallory. You need to see Mallory.
Yes. And that it's common, but no one's addressing it. And by the time you see your practitioner 6 weeks postpartum, you haven't returned to intercourse, and you probably think if you do have leaking, it's still within the normal realm, because you are still healing at 6 weeks.
You are.
And that might be somewhat normal, but there's things we can do to make you get back to normal faster.
Right. Yeah. Okay. Interesting. Fascinating. I love it.